The vaccine is the key to fight the virus. This is why we're looking for an health contribution for adults who refuse to be vaccinated for non-medical reasons. Those who refuse to receive their first dose in the coming weeks will have to pay a new health contribution.
Earlier this week, Quebec announced plans, kind of vague at this stage, to introduce a health tax or premium for those refusing to get vaccinated as politicians and healthcare workers grapple with those people who refuse to do so and of course, this increased strain on our healthcare systems. Is this the right approach? It's Thursday. I'm here with that issue. Chantal Hebert, Andrew Coyne, Althia Raj, good to see you all. First time in the new year. I'm happy you're here. I want to start by getting just your reaction to the idea and I guess, how it's been received so far. Chantal, you're in Montreal. Let's start with you.
Well, I'm hoping Premier Legault didn't think he would hit the hit of all times with this announcement because the reception was coolish, bordering on negative, and it's bound to increase on the negative side of things. I would argue that he has already accomplished most of whatever purpose he will actually accomplished with the announcement. He wanted to deflect the conversation. This news conference came on the day when he was about to explain why the chief medical officer resigned in the middle of what is a health crisis. The conversation switched to that announcement. It probably made a number of vaccinated people who have gotten impatient with unvaccinated people happy or made them feel good. And it probably sent some unvaccinated people to the vaccine clinics to get that first dose. But all of that being said, I'm not so sure whether, A, it's a good idea. I believe the government could lose that debate. No other party in the National Assembly significantly will back it in any way, shape, or form. The Premier said today he would introduce a bill in February. How do you collect that health contribution except on the income tax report? Too late for this year. Are we saying the government will be trying to collect a health contribution on the basis of vaccines in 2023? It all sounds like one of those we announce and then we decide maybe it wasn't a great idea thing from this government, and it wouldn't be the first time.
It sounds a lot like what our colleague Aaron Wherry called a trial balloon in his piece this morning. And I wonder, Andrew, whether it was that and whether it was effective, as Chantal points out anyway.
Well, we'll find out whether or not it's a trial balloon. As Chantal says, he does have a history of floating these things and then walking them back. And I see he's walked back the curfew, for example. It's probably not the best idea, and it's probably the courts would find it to be overstretching the government's proper role. But I'm almost inclined to favor it just by the extravagance of some of the reaction against it, with people claiming, this is going to, or equating it with denying unvaxxed people health care, for example, when clearly that's not what's entailed here. Or people saying it's going to lead to people being taxed for going skiing or taxed for eating sausages, to which, the only response is eating sausages a highly contagious, lethal disease? No, it is not. So, yeah, there's probably charter issues, but they're more narrowly drawn. I think courts will be interested in asking, is this likely to work? Are there less intrusive ways of achieving the same ends? Sure. But clearly, the case that there's a pandemic on, a worldwide public emergency, is pretty clear. And the fact that mass vaccination is absolutely essential to getting us out of that is also clear. Where the courts may draw the line is do you have to go this far to actually fining people for not getting vaccinated?
Right, provided it even gets that far, to Chantal's point. Althia, what did you make of the notion?
Truthfully, I think it's too early to say because so many details are missing from his announcement. I think it's creative. I think it speaks, as the Quebec Premier is so good at speaking to the public mood. I think a lot of vaccinated Canadians are very frustrated that they are basically being held hostages because the unvaccinated are flooding the hospitals. I mean, Premier Higgs, for example, today spoke about 9% of his provinces being unvaccinated, but being 70% of the folks in the hospitals. Premier Legault says it's 10% and 50% in his province. So I think that there is public opinion in line with the Premier's thinking, and public opinion surveys seem to suggest that a slight majority actually favor kind of putting the screws on the unvaccinated. The fact that it's not a user fee means it's not a challenge to the Canada Health Act. You could put it on the income tax, but Chantal rightfully points out when he speaks about introducing legislation and wanting to have a debate on it, well, then you get into, I mean, even if it made it into the income tax this year in the forms, you wouldn't really know that it worked till like the early summer. Right. But clearly sticks have worked. Vaccine mandates have worked. We saw that with the Quebec government announcing you had to have a vaccine to go to the pot and the liquor stores. There was a boost. Today on the health minister's call, the DM in Quebec who was on that call said that in the last 2 days, there's been a threefold increase in the number of people trying to get a first appointment for a vaccine. So clearly, even the threat of it has worked.
The threat of dépanneur wine has worked. Andrew, go ahead. Andrew, then Chantal. Yeah.
Where I do agree with some of the government's critics and critics of the federal government as well as, or the Prime Minister in particular, is I do think it matters the temper and the tone that public leaders speak about this. It's one thing to have carrots and sticks to try to encourage or incentivize or even penalize people to try to get them vaccinated. But I don't think government should do any of this with a tone of anger or encouraging or acceding to public anger about this. That's the last thing we need. We need to try to help people along to seeing their way to get vaccinated, as I say, if necessary, with sterner measures than just persuasion. But it should not be done in a tone of anger or vilification.
Okay, last word to you on this, Chantal.
I'm just curious to see how long Premier Legault will stick with this, given that I think it may cost him more votes than it will keep. There's a first poll out today that shows that the Coalition Avenir Québec has actually lost ground, not that they're going to lose the election if it were tomorrow, but lost ground for the first time since the beginning of the pandemic over the past month. The curfew was really unpopular. They backed off on that. Sunday store closings, everyone questioned the logic of it. And interestingly, in that poll, they're losing votes on the left, but also on the right to the Quebec Conservative Party, a very tiny party, but that is anti-vax or very anti-such measures. So I'm really curious to see whether he maintains unity within his own party. He has no support from the other parties, and they are not feeling any pressure to support the government on this, which is a novelty.
Vaccines work. They work to protect you. They work to protect the vulnerable people around you. They also work to support our frontline healthcare workers who are in danger of being overwhelmed by this Omicron wave. So we're not just supporting them, we're supporting the people who are at risk of seeing important surgeries and treatments canceled because our health systems are getting overrun.
23 long months now into the pandemic, and across the country, healthcare systems are feeling the strain, as we talked about, some from the unvaccinated. Hospitals overwhelmed, healthcare workers exhausted. So could this latest wave fuel that healthcare funding conversation more urgently that the premiers want to have? At issue is back. Chantal, Andrew, and Althia. Why don't I start with you on this one, Andrew? I mean, everyone has said they want to have this conversation, including the Prime Minister. He continues to say, not now. Is what we're seeing in terms of capacity overload, is that an argument to speed up and actually start talking about whether there is a funding issue or a different issue?
No, I don't think it is. We have long-run issues with the healthcare system that we've been staring at for a long time and haven't really done very much about. Part of that has to do with the level of funding, not so much because we're not spending enormous amounts now, but because of the aging of the population, which is going to continue for years to come. And that obviously is going to add to the strain on the healthcare system. But we also have much more of a problem of not spending the money we do spend very well. We don't spend it very efficiently, all the evidence suggests, and we don't have great sense of priorities, perhaps. So one thing that this may point to is, look, we spend amongst the highest of any country in the world per capita on healthcare, and yet we have relatively low levels of ICU beds. So that maybe suggests we need to shift some of our priorities. But look, even countries that have way higher levels of ICU beds than we do, way higher, much more resourced hospitals than we do, have run into enormous difficulties during this pandemic. Nobody could prepare for or have the level to meet this kind of surge in demand. We can look at maybe having more spare surge capacity on the side, but we can't run our hospitals at half full perpetually in anticipation of occasional pandemics.
Sure, that's an awfully good point. But Althia, does it mean that the conversation around funding should take place now, or that it should be delayed, to Andrew's point, because we aren't in a regular situation anyway?
Yeah, I mean, I know the premiers would like to have the conversation right now, but I think the government's argument that makes a bit of sense, frankly. It is a crisis moment. Like, you think about the meeting with the premiers and the prime minister on Monday. They didn't talk about reforming the healthcare system. They talked about how many Canadian Armed Forces members they could get to hotspots in their provinces. They talked about having more rapid tests. They talked about foreign credentials as a way of addressing the personnel shortage. So those conversations are being pushed, I think, to a time where we can have a more thorough assessment of what actually needs to happen. I mean, I do hope that the decisions and the creative thinking is actually happening in the bureaucracy, so that when politicians are ready to have the conversations, there will be interesting suggestions in front of them, maybe creative suggestions. Maybe we need to have different types of hospitals. Maybe we need to have more spots for interns. I mean, these conversations are all being had by experts. They're just not being had by the politicians at the moment. And I think that actually is understandable.
And we should say that the vast majority of the money that has been shoveled to the provinces to deal with the pandemic has come from the federal government now. But that will not be
$68 billion.
Yeah, that will not be for the rest of for the rest of the healthcare funding transfer. That's not just going to flow into their budgets permanently. Chantal, last point to you.
You've got elections coming in Ontario and Quebec, a really fragile health system that just about every voter has noticed. So expect in both provinces to hear a lot about that the problem is in Ottawa and the federal government not putting enough money in the system. Right. But that's the easy argument. It's not actually the core problem. There are issues of how the system is organized. The provinces are, I mean, if there's creative thinking, I've come to think over healthcare that creative thinking and healthcare is almost an oxymoron in this country. But if that's happening, I don't believe that you will find politicians with the fortitude to actually do the heavy lifting in the middle of a crisis. So I believe that conversation has to wait.
Okay, well, we will wait and have it again and again and again anyway. Thank you all very much. I appreciate it. Chantal, Andrew, and Althia.